This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. I'm Kyle Wiggs, your host. Thanks for joining us. We're joined by Dewayne Kirkpatrick. He's the radiology manager of Broaddus Hospital. And Dewayne, good morning. Thanks for joining us.
Good morning, Kyle.
Let's talk about your specialty here. Now, first of all, let's take one further step back. Tell us about the Broaddus Hospital facility.
So Broaddus Hospital is located in Philippi, West Virginia, in Barber County. It's a critical access hospital that also houses a swing bed unit and a nursing home, and takes oftentimes is the first point of contact for a lot of our population.
Okay, and as radiology manager, how would you describe your job?
So I oversee the day-to-day operations of the radiology department and ensure correct certifications and adherence to both state and federal guidelines. And with the Black Lung program, there are a lot of guidelines to follow and a lot of quality measures to ensure for our patients to make sure we get the best possible results for them.
Okay. Your background, where are you from originally?
So I'm from Elkins, West Virginia. Did my training at the University of Charleston in Charleston, West Virginia. Got a bachelor's degree from there, and then I'm currently working on a master's in healthcare administration with a specific in health informatics from Fairmont State.
Okay. Do you have a background in coal mining in your family? How has this particular thing kind of touched your life?
Yeah, so my wife's father is a coal miner. He's a fire boss, and her uncle is as well. And I've had my great-grandfather was a coal miner. So there's a lot of people in my life, and probably if we talk to most people in West Virginia, I'm sure indirectly or directly have some type of relation or contact with someone in their life that is a coal miner. So when I took the position here at Broaddus, that was something that I really wanted to start up, as it does hold a special place in my heart, and I wanted to make sure we were taking care of our miners. Right,
and especially you talk about people having this type of background in their families, especially in that region. There's, I would imagine just about everybody's family has some sort of background or someone in their family who's involved in the mines.
Oh, absolutely. I mean, it's one of the biggest industries in West Virginia. And so, like I said, indirectly or directly, there's probably someone in your life that is touched or knows someone that works in the mines.
Okay, with Broaddus Hospital, and as you mentioned, you've got this up and running, screening programs for miners. Obviously there's a need for it. How did it start? How far has it advanced so far?
So it's not a new program. It's something that's been around for a while. If we talk about what black lung is, it basically is what occurs when coal dust is inhaled. And there's been tons of efforts from the mining industry to limit and reduce this type of disease. The American Lung Association still estimates about 16% of coal workers are affected. And this is after decades of improvement. So there's a lot of efforts from the mining industry to try and reduce coal dust. From a healthcare perspective, a lot of what we do is preventative. We want to try and make sure that we get baselines with chest x-ray just to ensure that we kind of know as the miners' progression in the industry what their lungs look like.
Your role in kind of advancing this, what's it been like to try and enhance this program? You talk about preventative measures. Is that something is that an angle that the medical community has kind of come from that's a little bit different recently?
So I think from the healthcare perspective, what we want to do is make a meaningful impact on people's lives. whether that is preventative or treating the early onset of the disease. I think it's important to note that there is no cure for black lung. However, there is treatment that can help manage some of the symptoms and improve the quality of life for coal miners. A lot of the symptoms that occur from this would be something like coughing, shortness of breath, and coughing up black sputum. So again, what the purpose of the black lung program aims to do is to try and get an early detection of black lung, and if there's something that can be done to help ease the symptoms for miners, then we certainly want to be here to be able to help in any way that we can.
Okay, what are some of the things that can be done if this is detected early?
Some of the treatments would include medications that can help open the airways, oxygen, of course, pulmonary rehabilitation. In worst case scenarios, there are things such as lung transplants that can help as well. Of course, the best treatment is avoiding dust exposure, but in the grand scheme of things, sometimes that's something that's unavoidable working in this industry.
Mm-hmm. In terms of getting this baseline on miners, I would imagine you would, you encourage people to come in and see a physician regularly, right? Maybe multiple times a year if someone is subjected to this type of thing in the coal mines, just like anything else, right? Get that regular checkup with your doctor.
Right. The best action that we can do to compete against this disease is just getting that baseline, having that constant interaction with your physician. I think something that, we have Arch Coal here in Barber County, and one of the nice things that they do is they have a clinic in Grafton that encourages their staff to follow up with providers, and they've done a lot really to help enhance the health of their employees.
What type of screening measures are there if someone comes in who's maybe new to this industry and you want to get that kind of baseline? What type of work do you do with them?
So a lot of times we can do chest X-rays to get the baseline, but there's also methods of doing things with respiratory therapy just to kind of see where your lung capacity is, and if there's any type of alterations that can be done to ensure that you live the fullest and most healthy life.
Tell me about the miners' health surveillance program that is in place from NIOSH.
Yeah, so what that does is that's the basis for the black lung program.
Okay.
The National Institute for Occupational Safety and Health has over the years instituted that we want to offer every opportunity to our coal mining industry to try and prevent the progression of black lung. So what that entails is that we provide chest X-rays to detect and manage mining-related lung diseases, and that includes black lung disease. Beyond just inhaling coal dust, graphite and man-made carbon can also create issues with this disease. So practically what happens is that, the miner will receive a letter letting them know that, they would like them to participate in this black lung program, and gives them an opportunity and a means to be able to track it. And then what we do from a healthcare perspective is work with Centers for Disease Control and get a B reader, which is someone that specializes in looking at lung-related diseases, for them to continue to upkeep with the progression or the longevity of the miner's employment.
Okay. We need to take a break here, but I understand you and some of your colleagues actually went deep into a mine, right?
We did, yeah.
All right, we'll talk about that. We'll take a break, and we'll get into that in a moment. We're with Dewayne Kirkpatrick. He's a radiology manager at Broaddus Hospital, trying to help miners combat black lung and deal with the symptoms of black lung. This is Mon Health Talk. We'll continue the conversation on WAJR coming up after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday, our guest, Dewayne Kirkpatrick, Radiology Manager at Broaddus Hospital. And Dewayne and some of his colleagues recently took a trip deep into a West Virginia coal mine. Okay, Dewayne, let's get into this. How many of your colleagues went with you?
So I brought two of my staff members with me.
Okay. Was it your first trip into a mine?
It actually was my first trip into the coal mines. Like I was telling you, my father-in-law is a coal miner and has been asking me and telling me about this program where you can take tours of the coal mines, and thought it would be a good idea for me just to get a first-hand look. And you know how life is. Life gets busy and things get pushed to the wayside. However, as things became more personal and intimate here with the coal mining program, I wanted to ensure that we were not just having a theoretical or educational background on the coal mines. I wanted to have a real life experience so that we could really exemplify what it means to be empathetic and compassionate about what we do.
So how deep and far did you go into the mine?
So we went about 800 feet underground, and then once we were underground, went roughly 2 miles into this particular coal mine. Once we were about 2 miles in, we stopped and looked at one of the coal mining belts that basically brings the coal out, cleans it, and prepares it for travel.
Okay. What? Obviously, an incredible experience. What went through your mind when you were descending deep into the earth?
Just that in a matter of minutes, how far you actually go down. As we're on the elevator, like I said, it's probably a matter of minutes, but the mindset of how far you're actually traveling into the earth is just something that you can't really articulate very well. Like I said, in minutes, you're 800 feet underground, and it just, you get underground, it doesn't feel like you're 800 feet below the Earth's surface.
So that's higher than or right about the same as the New River Gorge Bridge. Just to kind of give you perspective, the height of that bridge, that's how far underground you were. What was the environment like? How did your senses handle it?
So, when you first enter the mines, it's a very large corridor. I think a lot of times our perception of what the coal mines is like, that it's very dark and very close quarters, and that couldn't be further from the truth. It looks like you're walking down a huge corridor, and it's well lit. They brought us to these. They call them man trips, and basically it's a way for them to get from point A to point B in a much quicker and efficient manner. And it's kind of like, a small train. It runs on train tracks, and so you gather into this man trip, and they were saying about 25 people can fit on this man trip. I don't know how. It was just 3 of us in there, and we were cramped. And I can't imagine how 25 miners get into this.
Were you in any areas where there was active mining going on? Did you interact with the people that do this for a living underground?
So we didn't actually go to where they were actively mining because it's about an hour into the mines. We did interact with miners on the surface and went through a lot of safety precautions. There was a lot of safety instructions, a lot of instructions about disaster planning. Like I said, they take a lot of pride in being very safe and very conscious of anything that can go wrong in the mines.
So what was the goal of this trip in your mind?
Well, like I was telling you, a lot of times we can read in a book, we can look at pictures online, and I think that there's a lot of useful information that we've gathered from technology, and but the one thing that I don't think that we can replicate is experience. And like I said, as we take care of people, a lot of times, as much as we would like to try and make sure that we embody the vision of our institution and provide the best care to every patient every day, sometimes I think it's a great reminder to get out into the community and see what the people we're taking care of, what they do and what they live. Mm-hmm. Any time that I have a clinic that I'm talking with, I like to go and visit the clinic to get a grasp of where these patients come from and what their walk of life is. I just think that gets us to a more compassionate and more compassionate way of looking at our patients.
Yeah, that's very well said. I mean, that's an experience that many of us, probably most of us, will never get to feel what it's like down, that far deep into the earth. Once you resurfaced, what was it like? Was it disorienting at all, or what was it like once you got back out into the daylight?
It was a little bit disorienting as far as, there's a lot of different air compression levels. So, one thing that I did notice was, a slight headache. I'm sure that people that do this on a daily living probably are used to some of the different air compression pockets that are within the mines. But something that I did discuss with my staff, both girls that went with me did say they had a headache as well. So I don't know if it's just our senses trying to reacclimate. It was certainly such a surreal experience and provided a lot of useful, real life experience for us.
Yeah, absolutely. Okay, before we let you go, how can miners take part in this lung screening program at Broaddus Hospital?
So there's a couple different ways that this happens. If you're a current miner, a lot of times you're going to be sent a letter notifying you that you're eligible for the Black Lung program, and we'll let you know all of the certified sites. They're also on the CDC's website. It gives a list of every site that is certified to be able to provide those Black Lung screenings. If you are interested in scheduling with Broaddus here in Philippi, our number is 304-457-8162. If you're a retired miner who is interested in being screened and no longer, of course, work for any type of mine, you may contact the North Central West Virginia Black Lung Center, and their number is 304-892-2850.
Okay, so Broaddus Hospital, 304-457-8162. For information on the screening program, and then the Black Lung Center, that number 304-892-2850. So
yes,
again, those are the numbers to call. Well, this has been a very interesting conversation, and Dewayne, we appreciate your time, great information, and good luck with this.
Thank you.
Okay, thank you for your time. Dewayne Kirkpatrick, Radiology Manager at Broaddus Hospital, as, again, a lung screening program for miners, very, very valuable there for our local coal miners. That's Mon Health Talk. Thanks for listening. Stay tuned to WAJR.